Hi, my name's Nina and I'm a diabetes dietitian. In this video, we're going to look at weight management and type 2 diabetes, including how weight and type 2 diabetes are linked, the benefits of losing weight and blood glucose control and how this can be achieved. We're also going to look at the 800-calorie diet, which has helped people achieve remission. So it's a common misconception that everyone who has type 2 diabetes is overweight or obese. In fact, 15% of people with type 2 diabetes are a healthy weight or underweight, whereas 85% of people with diabetes are overweight or obese. We're going to look at the reasons behind this. So the reason you're more at risk of developing type 2 diabetes if you carry excess weight is due to insulin resistance, especially if you're prone to carrying weight around your stomach area. Insulin resistance is when the cells in your body become less sensitive to the insulin that's produced. Therefore, when the insulin reaches the cells don't open up to allow the glucose to go into the cells where it needs to be. This leaves more glucose circulating in the blood. In this case, often our body tries to compensate by producing more insulin. However, this still doesn't work to reduce blood glucose levels because the cells aren't sensitive to that insulin. It can be likened to having lots of keys, but the locks are rusty and therefore the key no longer fits the lock. The other reason you might develop type 2 diabetes is due to pancreatic decline, which means your pancreas is no longer producing enough insulin and can be likened to not having enough keys. This is more likely due to age rather than to weight. In this case, losing weight may not help with your diabetes control. If you have type 2 diabetes and feel that you might be overweight, it could be beneficial to lose weight to help improve your body's sensitivity to insulin. The best way to assess where your weight is by using your body mass index, also known as BMI. On the screen is a BMI chart, which has your height down the side and your weight across the bottom. This can be used by tracking your height, so if this person was 5'11", and your weight, if this person was 14 stone, then looking where they meet in the middle. So this person would be overweight and therefore weight loss will be beneficial for the diabetes. Although BMI is a good indicator, it does have its flaws. It doesn't take into account body shape or muscle mass. And if someone is obese or overweight, it doesn't necessarily mean that they need to achieve their healthy weight if that isn't what feels best for them. So instead of aiming to achieve your ideal BMI, we would recommend aiming to lose between 5 to 10% of your existing body weight. On the screen, it shows the benefit of 10% weight loss. So it improves blood glucose control, which means it reduces your HbA1c. It reduces your risk of stroke and cardiovascular disease by improving blood pressure and cholesterol. It can help improve mobility. It can make you feel better if you're making positive lifestyle changes, and it can slow down the rate at which your diabetes progresses. And that means you might not move on to different medications quite as quickly. And in some cases, you might be able to come off existing medications. In order to achieve weight loss, we need to reduce the amount we're putting in through food and drink and increase activity levels. Although this sounds really simple, it's easier said than done, because the food we choose to eat and the activity we choose to do is habit, and it's learned over many years, and therefore it's hard to change habits. For that reason, we would recommend aiming to make small sustainable changes. So set yourself a few goals that you can achieve, and once you've achieved them, set yourself a few more. Avoid overwhelming yourself with the prospect of change or putting yourself on a fad restrictive diet, as it's unlikely this will provide the nutrition that you need, and also it's hard to sustain in the long term. So now we're going to look at how you can achieve weight loss, but it's important to set yourself goals that are specific to you and in relation to your own diet and lifestyle, and focusing on things you feel you can achieve. So consider the portion size that you're having at meal times. If you feel like you're eating too big a portions, then consider reducing this. Using the healthy portions plate can help reduce the amount of carbs and calories that you're having at meal times. This means you have a quarter from carbohydrate, a quarter from protein, and trying to choose lean protein, and then filling up on plenty of salad and vegetables. Then consider what you're having between your meals. So if you're having lots of high calorie drinks and high calorie snacks, then could you reduce this or could you swap your drinks to the zero or diet version? So fat is the most calorific of the nutrients. So by reducing the fat by changing your cooking methods or reading your labels and opting for lower fat versions of things, this can reduce the amount of calories that you're consuming. And then focus on your activity. So this doesn't have to be formal activity like joining the gym. It can mean just going for more walks, getting off the bus stop earlier, or doing more housework. This will all burn off calories and help with weight loss. So you may have heard of people putting their diabetes into remission. This doesn't mean that the diabetes is cured or reversed, because it may not be permanent depending on what happens. So remission means that the blood glucose levels are below the diabetic range, so the HbA1c will be below 48 millimoles per mole without medication. This is usually achieved with rapid weight loss. The best example we have of diabetes remission is from the DIRECT trials, which was a study done where participants ate just 850 calories from soups and shakes over a 3 to 5 month period. After this period, food was reintroduced slowly for weight maintenance. For those who did achieve a 10 to 15 kilogram weight loss and were able to sustain this weight loss, many did achieve remission. So this may sound appealing, but it isn't an easy approach to follow, and it's not for everyone. So please do discuss with your GP or your diabetes healthcare team before trying this. At the moment in the UK, there's a few areas that are trialling this, which means that the meal replacement shakes and soups are available on prescription. At the moment, Liverpool isn't one of those places, but it may be in the future. So I hope from this video you've learned a little bit more about how weight is linked to type 2 diabetes. If you are someone who's struggling to lose weight, then please go and see your GP. They'll be able to direct you to support that's available, and it may be suitable that you're referred to a dietitian.